I'm Roberto Sorrentino. I am Associate Professor of Prosthodontics and Digital Dentistry at the University Federico II of Napoli in Italy. And my main field of interest are dental materials, luting materials, and digital prosthodontics. I would like to talk about hybrid materials, hybrid ceramics, just because they're becoming more and more common between general practitioners and prosthodontists. You know, we are living the period of minimal intervention dentistry as well as 3D printing and CAD/CAM technologies, so the digital approach has become much more widespread in the last decades. And we have two extremes, because we have on one side polycrystalline ceramics just like zirconia. They are tough, but they are not very aesthetics. On the other side we have glassy ceramics, so they are very beautiful, but they are not so resistant. And just in the middle we have this new family of materials called hybrid ceramics. And well, their main indication is for sure the single tooth restoration in posterior areas for CAD/CAM design or 3D printing. Mainly CAD/CAM design right now, but the technology is evolving very, very fast. And the indication right now is limited to single elements because of the dimension of these blocks that were designed as polymer infiltrated ceramic networks or resin nanoceramics. So you can easily machine them. They are very user-friendly for machinability, and then you can just lute them in one shot, so they are very user-friendly. You have to take care of the content of the material to choose between sandblasting or acid etching before cementation. It depends on the content, mainly on the glassy content. So if the hybrid material is prevalently made of ceramics, it's better to use hydrofluoric acid etching. Whilst if the resin nanoceramics is mainly made up of composite materials, it's much better to sandblast. Other materials, just like the Cerasmart by AGC, is the only one that, since have both content more or less the same percentage, you can use both conditioning treatment. And my tip for clinicians is if you want to make both treatments, it's much better to make before hydrofluoric acid etching and then mild sandblasting. Otherwise you can interfere with the removing of the glassy content of the matrix. If you have as antagonist natural tooth or a composite restoration, everything is very fine. If you have something very tough, just like a zirconia restoration, you have to keep in mind that you can have a kind of accelerated aging of wear of this material, just like it happened with the direct composite restorations. So you just have to take a look at the whole clinical situation and not at the single tooth. And one of the main advantages, according to me, is the reparability of these materials. I mean that if during time you have any kind of nano leakage at the level of the margin, you can easily fix them under the rubber dam, just like they are normal composite onlays or overlays. So you just have to make sandblasting, bonding, and then place a little layer of cement or direct composite material. As regards cementation, clinicians have to use resin cements, of course, under the rubber dam to lute these kind of restorations. And my advice is to go for universal luting agents, just like GSAM1, just because, of course, since the main indication for this material is the single tooth restoration in posterior areas, we have mainly to face with dentin or composite buildups. And we know that universal luting performs, in this case, is better than conventional 3-step.